Hi, I wanted to talk about thyroid function because it's a very complex subject that's been simplified too much in our society. So if you are diagnosed with hypothyroid, that has meant that your doctor has taken a TSH test, thyroid stimulating hormone test, and if that has been elevated, basically if your hypothalamus has actually not gotten enough feedback from the thyroid hormone, you are going to have an elevated TSH. If you have an elevated TSH, you're given typically Synthroid, and that's the end of the treatment protocol for standard conventional medicine. The problem with that model is that if you have a still normal TSH, but for some reason you're not able to convert thyroid hormone from T4, which is the Synthroid that you might be getting, to T3 in your peripheral body fat, there is no testing that's traditionally done to tell you if you're actually converting or not. And you may still be experiencing symptoms because T3 is between 3 and 10 times more powerful than T4. So you may be getting a huge amount of Synthroid, but not be receiving the benefits of that Synthroid. So what you would want to do to offset that would be to do a TSH, a free T3, and a free T4. And that would give you the information that not only do you not have enough thyroid in your system generally, but you specifically don't have enough T4 or enough T3. So you can see the problem here is that you could actually have someone taking a huge amount of Synthroid, going to the doctor and saying, hey, I have a continued problem, I still feel all the symptoms I had, and the doctor returns and says, well, your TSH is in the normal range, it must not be that, when they haven't done the further testing. It's actually possible to test for a range of other things. You can test for antibodies to thyroid, which would tell you some other information about how actively your thyroid is being attacked. You could test for reverse T3, which is looks like T3, but the body doesn't know how to work with it. And you can test for just a laundry list of other things that would tell you a lot more information about your thyroid. But at this point, simply because all you're conventionally going to be given is a TSH, all I ask people to get is a T4, free T4, and a free T3. And I have clinical cases where people have been normal TSH, normal T4, and no T3. There's also been cases where people are actually experiencing side effects where they have very high T3, even though taking a very low amount of T4. So they're actually going into hyperthyroid, or their heart palpitations, etc., because they're getting too much T3, and they need to have a lower dose, even though the TSH is in the normal range. So if you have too little or too much, you need to have at least the 3 numbers to give you an idea of where you are. And now the treatment for that is traditionally, the standard one is T4 or Synthroid, levothyroxine. And that's, for the majority of people, that's fine because you can convert enough from the T4 to the T3. But for a subgroup of the population, they're not going to make that conversion, in which case there's a discussion about Armour Thyroid, which has had some difficulties in the media recently because it's been under such demand. It's actually been over, the production has actually fallen behind demand, and that's because the Armour Thyroid, which is standardized at this point, people say, well, it's animal based, and like, well, in the 70s there was about a 10% variation in the ability of the thyroid, that animal-based product to be, consistently standardized. But that's only been since the 70s, and since that time, it's been standardized as well as the synthetic stuff. So the combination of Armour Thyroid, that's got about 80% T4 and 20% T3. So you can see in a subgroup of the population, it would be better to have them on Armour because they're not able to convert to the T3, and that Armour is going to give them the nice combination of the T4, which is what you want most of your thyroid to be, and the active T3, which gives you the benefits. There is a subgroup at this point of people who, whenever you give them Synthroid or you give them thyroid hormone, their thyroid antibodies go way up, and you have to document that by taking a baseline, which isn't normally done. But if you take a baseline, their antibodies have actually elevated to a point where they're basically not getting any benefit from the thyroid you're giving them. That basically the thyroid comes in, it's absorbed, the antibodies lock onto it before it can get to the cells, and they don't get any benefit. In that case, it's actually more beneficial to switch to a very small amount of cytomel, or T3 itself. And you see what happens is you've got the T4 and it's coming in large doses, it's not being effective. And what you want is to actually get a little bit of T3. And that little bit of T3 kind of comes in underneath the radar of the immune system and allows the person to benefit from thyroid without having that kind of immune response. So the basic take home is to at least start with the 3 levels. Start with TSH, free T3, free T4. Without those 3 numbers, you really don't know how active the thyroid stuff is in your body. Now this is a tape for people who've had problems with thyroid and are continuing to have problems with thyroid well beyond Synthroid. So these are people who are already having difficulty. If you haven't yet had your thyroid tested, please go and begin with that process with your doctor. I hope this is helpful. This is Dr. Maloney. I'm a naturopathic doctor here in Augusta, Maine. Thank you.